everyone, I'm Sarah. I'm a health educator for A Step Ahead Tri-Cities, and I'm here to talk to you all about three things today. We're going to talk about birth control, we're going to talk about STDs, and we're going to talk about NAS. These are typically the things that we cover in a group session, but with everything going on right now, then I'm just making this video for you all to see and view at your own time. I'll start by talking about what A Step Ahead is. And A Step Ahead Tri-Cities is a foundation that provides long-term acting birth control to women in the Tri-Cities area. We can help make your appointment, and we can help provide transportation to get you to and from the appointment. And of course, we provide education about birth control and other things as well. So the three types of long-term acting birth control that we provide through our program is Depo-Provera, the arm implant, and the intrauterine device. And I'm going to go over all these three, and these are the only three that we provide, but I am going to go over some other birth control options as well. So the first one that we're going to go over are the intrauterine devices. This is kind of what they look like right here. They come in different shapes and sizes, but they're made of soft, flexible bioplastic or thin, flexible copper. This is kind of an example of a copper one right here. They are very effective choices. They're about 99.7% effective, and they last 3 to 10 years depending on what kind you choose. So there are hormonal options, which these would be the hormonal options. And then there's non-hormonal, which is the copper one. And the way that the copper one works is it works as repelling sperm. So again, this is the copper one, and the copper one lasts for about 10 years, whereas the hormonal versions last about 3 to 5 years, depending on what type that you get. The procedure to place these is you would just make an appointment. You can make an appointment through us. You would get fitted for one of these. You would go in for a female exam, and they'd fit you for one of these if you would like. So that's the IUDs, also known as the intrauterine device. The next one that we're going to go over is the arm implant. And this is kind of the shape and the size of the arm implant right here. You can see it's flexible. It's made out of bioplastic as well. It's hormonal, so it is inserted up under the skin. It goes about right here in your arm, and you can kind of feel it if you press on it, what it would feel like under your arm. And it also releases a small amount of hormone to prevent ovulation. It's about 99% effective, and it lasts about 3 to 4 years. And once it's inserted, it's maintenance free. That's a great thing about a lot of these long-term acting birth controls. You can get them placed, and then you don't think about it anymore. You can just forget that it's even there. So one of these things is one of the side effects that may reduce your periods. With the IUDs, they may reduce your periods as well, with exception of the copper IUD. The copper IUD might increase your period. It might make it a little bit heavier or longer. So what that means is if your period usually lasts about 5 days, it might last 6. So that's the IUDs and the arm implant. The last long-term acting birth control, and I don't have a model of that, is the Depo-Provera shot, or most people call it the Depo shot. It's an injection of hormones that you would get every 90 days, so every 3 months. And it is 98% effective. So if you go with your appointment and exactly to that 90 days, you're not late for your appointment, then it's 98% effective. And typically the Depo shot decreases periods as well. The way that the Depo shot works is it's a hormone that's injected that prevents ovulation, and it also makes the cervical mucus thicker so the sperm can't get through. The ones that I've talked about, the IUD, the arm implant, and the Depo shot, they do not protect against STDs. With the Depo, you will need to make an appointment every 3 months to come back to get your shot as well. Whereas the arm implant and the IUDs, you don't have to come back unless you want it removed or just for your female exam every year. Once they're inserted, they're usually maintenance free. So those are the long-term acting birth controls that we can provide and that we can get you set up with if you would like. The other birth control methods that I'm going to go over are the diaphragm and the cervical cap, the pill, the patch, and the ring, and then we're also going to go over the external and internal condoms as well. With a diaphragm or cervical cap, it's kind of like a little plastic, flexible, round disc, and it can be inserted up to 6 hours prior to sex. You must be comfortable inserting it yourself and removing it yourself as well. With perfect use, you have to use spermicide with it, and spermicide repels sperm. But with perfect use, it's about 92 to 96% effective. So not as effective as your long-term acting devices. But how it works is it acts as a physical barrier to sperm, and it is inserted over the cervix. You would need to go into the doctor to get a nurse practitioner or a doctor to fit you for one of those. Every female is different, their anatomy is different, so you'd have to make sure that you're measured correctly for that by a practitioner. So that's the diaphragm and the cervical cap. The pill, I feel like, is the birth control that most everyone has heard of. There comes in many shapes and sizes and brands that you can get with the pills. They're 98% effective. You take them orally once a day, and you usually take them the same time of day as well. And the way it works is it releases a small amount of hormone to prevent the eggs from being released. In real life, they're about 91% effective. Some people forget to take it. Some people don't take it the same time of day. So it just kind of depends how effective they are by how the person is using them. The last one that we're going to go over is the patch and the ring. And the birth control patch is a small skin-colored patch. It's about this big. It's very effective at preventing pregnancy, and you wear it typically on your arm, or you can wear it like on your hip or maybe your bottom. And you wear it for 3 weeks, and then you take it off the 4th week to have your period, and then after your period's done, then you replace it with a new patch. So that's a little bit about how the patch works. And the way that the patch and the ring work is the same way. It releases a small amount of hormone to prevent the egg from being released. With the ring, it's about this big, and it's flexible plastic that releases hormones as well, and that's inserted vaginally. You wear it for 3 weeks. You remove it on the 4th week to have your period, and then you replace it with a new ring. So both the patch and the ring work kind of similar in that aspect. With both male condoms and then internal condoms, they work the same way. Male condoms are a very good way to prevent STDs. So even if you're on birth control, you still want to be mindful that STDs definitely happen. We're going to talk about that next. So condoms are a really great way to prevent STDs. You do want to get checked for STDs at least once a year. The health departments locally provide those testings for free. You can just call them and make an appointment to get tested for STDs. Internal condoms, some people call them female condoms. Those are different from male condoms, but you do not want to use a male condom and a female condom together. That's something that some people get confused. And then with both of those male and internal condoms, you want to make sure that they are stored in a safe, dry place that's not gonna, it's gonna be free from maybe breakdown of the condoms, so you don't want to keep them in a wallet. A bathroom would be a great place to keep them, so that way they're not getting too hot or too cold, and they're going to kind of maintain a good temperature and not get worn as well. So that's a little bit about condoms. The next thing that we're going to talk about is STDs, which stands for sexually transmitted diseases. Most of the time now they're referred to as sexually transmitted infections. They kind of changed it from diseases to infections to just encompass more terms. But the symptoms for STDs are about the same. So it's hard to tell by your symptom what you may have. But some STDs don't have symptoms at all. That's why it's important to go get checked, because even if you're having no symptoms, you could be carrying an STD. So symptoms could include rashes, bumps, sores around the genital area, pelvic pain, abdominal or back pain, unusual discharge from the penis or vagina. So those are some of the symptoms that could exhibit. There are bacterial STDs. There are parasite STDs as well, and then there's viral STDs. We're going to go over all three. Bacterial could be chlamydia, gonorrhea, or syphilis. Those are examples of bacterial. And bacterial just means that they can be treated with antibiotics. And the sooner you get them treated, the better. So that's why it's important to go in and get tested, because they could tell you possibly that you have bacterial STD. You can get an antibiotic for that, and then it'll go away. For a parasite STD, this is pubic lice. So that's something that you would want to get checked as well. And then there's viral STDs. These do not have a cure, and you can always be a carrier. So an example of this, or the most common one that we've probably heard of, is HIV, which stands for Human Immunodeficiency Virus. It can be managed with medication, and it can develop into AIDS, which stands for Acquired Immunodeficiency Syndrome. You can get HIV in contact with body fluids, such as semen or blood. If there's like open sores on the mouth, then that can be a way that it's spread as well. You can get HIV through vaginal, oral, or anal sex if no condoms are used. And one of the most common ways to get HIV is by sharing or using dirty needles for injection drug use. So those are all common ways that HIV is spread. It is perfectly safe to have a normal contact with an HIV infected person. So that would be like handshaking. If you're in the same room with someone who has HIV, then that's, of course, perfectly fine. You can't get HIV by just being around someone. It has to be contact with bodily fluids or something like that. Condom use or taking medication called PrEP prevents HIV infections as well. Another virus is HPV. That stands for human papilloma virus. One of the symptoms for that is genital warts. They do have vaccines that help prevent HPV and HPV-related cancers. Some HPV strains can go on to develop into head, neck, cervical cancer as well. The vaccine that they make to help prevent HPV and HPV-related cancers is called Gardasil. And you can get that at your local health departments as well. The last one that we're going to talk about is herpes too. Usually you have bumps or sores that come with herpes, and that's a virus that you would need to get treated for as well. So those are STDs or STIs that we're going to go over. Again, it's important just to go get tested for those once a year to make sure that everything's okay. The last topic that we're going to cover today is neonatal abstinence syndrome. The reason that we go over this is because it is a growing problem in our area, specifically in East Tennessee. Some people abbreviate it as NAS or NAS. And what it is when a newborn, when they're exposed to drugs while developing in the uterus. So while that baby is developing, if the mother is taking any sort of pain medication or opioids, that can pass to the baby, and the baby can develop a dependence on those substances. And whenever the baby is born, then it still has the dependence, and it goes through a withdrawal. If you've ever seen someone go through a withdrawal before, then you're probably familiar with the experiences or with the the side effects of withdrawal. Some of those can be fever, seizures, eating difficulty, diarrhea, tremors, or breathing changes. All those can be associated with withdrawal. Whenever the baby is born, then a nurse can score it on something called a Finnegan scale. So that's 1 to 10, usually 10 being the worst and 1 being not so bad or mild. With the more extreme cases, the baby may have to go into the NICU or possibly have a longer stay in the hospital or be treated with medication. It just kind of depends on the withdrawal symptoms that they are experiencing. But they would have to be weaned off the drugs just like a regular person would be. But all opioids, prescription narcotics, other illegal drugs, and medication for recovery, all of those can cause NAS births. And there's no way of knowing, if you are taking that medication, there's no way of knowing if your baby will develop NAS until the baby is born. Some things make it more common to have NAS. For instance, if you're a smoker and you also take any of those narcotics, then your baby may possibly be more at risk to develop NAS. So NAS is something that we're trying to educate people on, to let them know about, because a lot of people don't know about it. And there's things that you can do. There's partnerships like 180 Nurse Partners that you can get involved with. Or if you know someone who is pregnant and taking narcotics, hopefully you can help them get some help, get them in contact with someone who can help them prevent this, or let them know how to deal with this if this does happen. So we've talked about birth control, long-term acting birth control. We've talked about STDs, and we've talked about NAS. The last thing that I'm going to talk about is how to get access to birth control. During this time right now, sometimes I know the clinic hours have been altered at several health departments and just kind of clinics around the facility. But if you are interested in getting a long-term acting birth control, please call us. We would love to help you out. Again, we're with Step Ahead Tri-Cities, and this is what our brochure looks like here. And the number that you call is 423-415-0277, and we will help you try to get set up with an appointment. I know that Sullivan County Health Department, for their family planning, they're doing telehealth, and they're also giving prescriptions for the uninsured that they can pick up at the health department. I know they're kind of doing like a drive-through style. I know the Washington County Health Department is doing some similar things where they might do telehealth as well. ETSU Family Medicine is still placing long-term acting birth control, but it's taking a little bit longer with everything that's going on right now. So it could take about 3 to 4 weeks to get an appointment. But again, I'll give you that number one more time. So if you want to make an appointment for long-term acting birth control, so again, that's IUDs like this, or Nexplanon, or the arm implant that looks like this, that goes in your arm, or the depot shot. Those are the 3 that we can make appointments for. Again, that number is 423-415-0277. Thank you for listening, and I hope you have a great day. Bye.